For the dilemmas debate topic, we chose to do ours on vaccine mandates against COVID-19 and if they should or should not be mandated to all healthcare workers. I am personally on the side that they should be mandated to all healthcare workers. As a healthcare worker, you have a duty to do no harm. That is one of the core ethical values that we stand and upheld to. But when you choose to not get the COVID-19 vaccine, you're going against this. The COVID-19 vaccine has shown that it does prevent the spread of the virus, and it reduces the risk of giving it to someone else and the symptoms that someone may get from the virus. As a healthcare worker, you come in contact with so many different people, and those people are more than likely at a weakened state since they are in a hospital. Since these patients are at a weakened state, the virus likes this. It's able to get into the body easier and take over the host, which would be the patient, and infect them and make them very sick with this very highly deadly virus. The question I may ask is, why is the COVID-19 vaccine so different than any of the other vaccines? As a healthcare worker, we're mandated and told that we need to get this vaccine and this vaccine. Every year we have to get the flu vaccine. That is just one of the things as a healthcare worker you have to do, because we know that vaccines work and that they do prevent the spread of these highly deadly and infectious diseases. Another topic that I could say is you don't have to be a healthcare worker. If you cannot follow the policies that the hospital or place that you work as a healthcare worker has enforced, there is nothing that is keeping you there. As a hospital, their sole purpose is to save lives. Again, that is what the vaccine does. That you have no obligations to stay at this place. The question that is brought up is it safe? What is the COVID-19 vaccine? Well, the COVID-19 vaccine is something special in its own right. It's an mRNA vaccine. So what this means is that mRNA is created in the lab, and it's created with substances that we find and use all the time, like fats, sugars, and salts. And they're able to use and change the molecular structure of those substances and create it into a form of the vaccine that whenever we get the vaccine, it's able to teach our cells to create these proteins. And then these proteins are able to create an immune response, so then the body can produce its own antibodies to fight off the antigens, the COVID-19 virus. It's able to fight that off. Something that the COVID-19 vaccine does not do is put a live or weakened virus inside of you, like many of the other vaccines do, that we are already required to get. But there doesn't seem to be an uproar with those vaccines but it does with the COVID-19 vaccine. The COVID-19 vaccine also does not enter into the nucleus of the cell. So this means that it's not going to change our genes. Once the COVID-19 vaccine creates the immune response, the ingredients get broken down, and then it gets excreted through our body like waste, which is a normal thing that occurs. One of the benefits of the COVID-19 vaccine is that our body is able to develop its own immunity without us having to get the COVID virus. The COVID virus has killed hundreds of thousands to millions of people. And this vaccine is able to fight it off by allowing our body to create the immunity without us having to suffer through the signs and symptoms that one may get from the COVID virus. One of the scary things about the COVID-19 virus is that you could be asymptomatic. So this means that you could have the virus, the strand inside of you, without any symptoms and not even know it. As a healthcare worker, you are working up close and personal with your patients. And without even knowing, you could be giving them this virus. Like I previously stated, they have a weakened immune system as a patient. So this virus is able to spread to them so much easier, and you may not even know it. I think that would be an awful feeling to someone if someone got very sick and there would have been a way to simply prevent this from happening with a simple vaccine. A study done at Yale University said that the COVID-19 vaccine has prevented nearly 280,000 deaths and has prevented 1.25 million hospitalizations in the US alone. And this was in 2021. I believe those numbers are quite higher now. There is no doubt in my mind that the COVID-19 vaccine has and will continue to save thousands upon hundreds of thousands of people's lives. With the uncertainty of the COVID-19 virus, its effects are deadly. And when we were gifted this vaccine, it changed how we could face this deadly, unspeakable virus. This vaccine allows people that have a weakened immune system, pretty much everyone, to reduce the side effects of the COVID virus, to give some immunity to the virus, and it has saved countless of lives. Through all these facts, I believe that mandating the COVID-19 vaccine is not only a thing that needs to be done, but it has to be done. As a healthcare worker, you have to put your own feelings aside to do the better good. And by getting the vaccine, you are doing just that. You're standing up to the core ethical value that we upheld to do no harm. That is why the COVID-19 vaccine should be mandated to all healthcare workers.